Hello, everyone. My name's Dr. Paul Richardson, and I'm the Clinical Program Leader and Director of Clinical Research here at the Jerome Lipper Multiple Myeloma Center at Dana-Farber. And I also serve as the R.J. Corman Professor of Medicine at Harvard Medical School. And it's really my profound honor and privilege that Larry Rybacki has most generously chosen to direct the funds from the annual Rybacki Memorial Golf Tournament to support our clinical research, and in particular, to honor his dear friend Bill Driscoll. It's important to note that community fundraisers like the Rybacki tournament allow our team to really continue the work needed to help others with myeloma and to meaningfully improve outcomes for our patients. So this is an enormous thank you to the sponsors of the event today, all the supporters, all the participants, and the volunteers of this year's tournament. And I just want to share with you that obviously in the multiple myeloma group, it's been an amazing journey over the last 20 years or so to transform the therapeutic landscape for our patients. Importantly, and it's lovely actually to have in the background a very lovely patient and his wife, who I had the privilege of caring for about 30 years. And when Jim first came to visit with me, he was actually destined, unfortunately, if this treatment had failed him, to go to hospice. That was almost 25 years ago, in fact, when he came to Dana-Farber, and we lost his battle against his disease about a year ago. So this has been transformative in terms of advances in improving outcome. And remarkably, Jim died actually myeloma free, and he will be, in his memory, he would want me to share this story because the reason for his passing was actually not the myeloma, but actually complications of a transplant that he'd had to have many years before, which had left him with a secondary leukemia. And whilst the fight against that had been valiant, it unfortunately proved to be the cause of his passing. And it points to a whole new generation and a whole new approach in myeloma therapy, where with the new treatments, we've been able to put some of the older treatments that had some serious side effects in the longer term behind us. And one of the focuses in myeloma research at Dana-Farber is how can we think strategically about the disease with all the advances in the last 20 years, transforming prognosis, and leave behind some of these more challenging older modalities, which at the time helped, but now with patients living 15 and 20 years as opposed to at most 5 and possibly 10, leaving those older modalities that could give you things like secondary leukemia behind and only use them if we ever have to. So in that context, it's my privilege to share with you that we now have 20 new treatments in total over the last 25 years approved for multiple myeloma. And that's one of the reasons why Jim did so well for so long. And it was such an honor and privilege to care for him and all our myeloma patients. Now, there's lots more to do. We still have not cured the disease. But with that kind of momentum and support like yours, we're very, very hopeful that we will be able to further improve outcome for all our patients. And in that spirit, Determination 2, Determination 1 being the study in which we defined that you don't need to offer transplant to every patient, the consequences of which, unfortunately, were the reason for Jim's final passing. In Determination 2, we're looking to build on this previous research to help patients and their care teams, above all, tailor treatment strategies to deliver the longest and best quality of life. And so we're very excited by this. And so it's very apropos for me to share Jim's story with you because it's so relevant to exactly what your support is going to actually directly help move forward. This so-called study, Determination 2, building on Determination 1, all run and led by Dana-Farber, all actually underpinned by philanthropic support such as yours. Now, I think it's worth mentioning that traditional funding sources actually don't cover the full cost of this kind of groundbreaking patient-centered clinical research. And philanthropy from groups like Rybacki Memorial, the Rybacki Memorial Golf Tournament play an absolutely vital role in moving this research forward and faster. So I really want to thank you for your support and really share with you that you are providing for our patients new hope on the horizon, and in particular, not just for our patients, their families and the extended loved ones, but to the field as a whole, because we have a truly global reach at Dana-Farber. And so from myself, from our team, and everyone at Dana-Farber, a huge thank you, and have a wonderful day playing golf. Thanks again.